Hello, and thank you for joining us on the Stay Healthy Knoxville podcast, brought to you by Simply Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community of Knoxville, Tennessee. And now, here is your host, Dr. John Mark Chesney.
I'm super excited to have on the show today Dr. Debra Durst. Dr. Durst has quickly made a name for herself as a leader in the field of regenerative health and sexual wellness. We are fortunate to have her practicing here in Knoxville and providing her services to the Knoxville community. After visiting her clinic, you can tell that every part of their practice has been well thought out, with a very welcoming environment and ambience to the friendly staff that's well trained, and certainly Dr. Durst herself. After 20 years as an emergency medicine physician, Dr. Debra Durst founded RevitalyzeMD in order to explore her passion for helping people to be their very best from the inside out. Her medical clinic offers the latest in non-surgical procedures, laser treatments, IV therapy, nutrition, peptide therapy, and aesthetics. After years of continuing education, extensive training, and experience, Dr. Durst has become an expert in the field of sexual medicine and wellness, combining regenerative medicine, hormone replacement therapy with cutting-edge sexual wellness procedures. Dr. Durst has created a one-of-a-kind medical practice that will help patients of all ages regain their confidence and enjoy their lives to the fullest. Dr. Durst is board certified in emergency medicine as well as board certified in anti-aging and regenerative medicine. She is also fellowship trained in metabolic and nutritional medicine. Dr. Durst, thank you for coming on the Stay Healthy Knoxville podcast.
Thank you, John Mark, for having me.
Certainly. Well, understand you've been practicing medicine for a while, and love to hear just how you got into medicine. Understand you spent a good chunk of time in emergency room medicine, and then transitioned into the field of more regenerative medicine. So take us back on that journey of your training and your experience and what led you to where you are today.
All right. Well, how long do we have? It's been a long time, right?
Sure. Well, let us have
way
it.
back. But so basically, when I started college, I wasn't exactly sure what I was going to do. And my undergraduate training was in pharmacy, and always really thinking about medicine, but thinking, kind of combining. And way back at the time, pharmacy degrees were not quite as long as they are now. So as I trained and then became a registered pharmacist, I just realized I didn't have any patient interaction or care. And so then I realized I wanted to do more. So I ended up going back to med school, and I didn't know what I was going to do with medicine. I was pretty certain I wasn't going to do two things, and one was pediatrics, and the other was emergency medicine. Surprisingly enough, I was forced to do a month in emergency room in my fourth year. And then I was scrambling to get a residency in that because I loved it. So, just seeing anything walk in the door, it was exciting. I worked in a little rural ER at the time because the people that were going into emergency medicine got the Ohio State spots, and I went out to the country to do mine. But it actually ended up working out perfectly, because you get to see everything and you got to do a lot. So it was super exciting for me, and it changed my direction. And so I did an emergency medicine residency, and that was in Cleveland, Ohio. All of my other education was at Ohio State. And so I have been an emergency physician for a long time, and I'm still boarded in emergency medicine, still occasionally work the ER. But what happened is, after a good solid, at least 10, maybe 15 years and a few children later, you're balancing a lot, and you're starting to notice that you're just not handling, the stress as well, and you're tired, And so as I was doing that and working what I had been doing for, 15 years, all of a sudden I realized that I'm not the only one complaining of it, but there's coworkers, both men and women, and then patients. And so again, there weren't many answers in traditional medicine. And basically, I kept hearing that same story over and over again. And so I went to my first anti-aging conference about 10 years ago. And then I realized there were a lot of answers. I just wasn't taught those answers in traditional medicine. And so it again changed my trajectory to anti-aging medicine. And so over the subsequent 10 years, I just started to learn more and more. And it's eye-opening how much is out there that you're not taught in traditional medicine. And so that's kind of how I ended up in anti-aging, in the anti-aging field. And of course, that has progressed since then because there's just so many different options out there. And so that's what RevitalyzeMD was about, is just bringing anti-aging to patients that don't have a lot of other options.
So it sounds like it came out of your own health journey of, realizing, as, you said there's a few children and what happens, changes and fatigue, and started pursuing for your own health. Is that right?
Yeah. I mean, really, yeah, it's a real life journey, so it was me as personally, just noticing changes that I wasn't alone in noticing. So as I'm getting tired and I'm not sleeping well, and I think it's maybe night shifts, but everybody else is complaining about the same thing, and the patients are complaining about the same thing. And my energy level, libido changes. Is it children? Is it stress? Is it balancing everything that we're balancing? But I wasn't the only one feeling it. And so it was, it was just me finally looking for answers. And what I saw is traditional medicine, we would put people on medicines. So as they were approaching my age and they were anxious or they weren't sleeping well or they were tired, they would go to a physician. Everything would look good, right? We have normal blood work and we're told everything looks good. And we were telling people the same thing in the emergency room. And instead, there were some hormonal changes that can cause a lot of this. And that's why I wasn't the only one feeling it, but patients, coworkers, friends. And so I just kept hearing the same thing. And yet nobody had anywhere to go for answers. And so I didn't realize that either until I went to my first conference, that there were just so many answers. And so, yeah, it was a personal journey. I started doing different things and I started to feel better. And so that makes you want to educate and bring it to others because there's not a lot of options out there.
Was it more like kind of a slow journey? Like you went to that first conference, right? And then was it from there, just a spark got ignited, okay, I'm heading this direction, or more of it was slowly over time, the more you got into it, the more your career path, started shifting?
It was definitely a slow journey, because it's been over the last decade. And so really what happens is you start to learn a little bit more and then you start to try something, or then you'll talk to friends, because I didn't open the doors to RevitalyzeMD until 2017. And so I would learn more and I would try different things. And then the more you learn, the more passionate you become about making a difference. And so it was a slow but very real life journey for me.
Oftentimes I find in when there's a career, if you will, career change or direction, that there's big decisions though of saying, okay, I'm setting up shop. I'd imagine that was a big kind of okay, I'm really doing this.
Yeah, it was a big step in a lot of decisions. And actually, when I was in a smaller office out this way, in Farragut, when I opened, I don't think it was as big a step as when I launched the new office. To me, that was the big step. It was a life-changing decision for me. And so I had to say, I was passionate about emergency medicine. For the 15 years I was there and not learning anything else, even though I was feeling some functional changes at the end and symptoms, I loved what I did. I felt like I made a difference. And then it got to the point, maybe I was tired or maybe I was just passionate about what I was learning, that I didn't wasn't as passionate about emergency medicine as I was before.
Sure.
But I had to figure out whether passion was enough for me to change my direction fully, because I felt like otherwise my schedule was pretty good. It was great for being a mom. I could balance things. I could travel because I love to travel. And so I could work. I, made a good living, and I could almost dictate my schedule. So it's usually money, hours, or passion that people, change career directions. And for me, it was the passion was strong enough for me to open the doors to the new location in January of 2019.
And, you mentioned too, like I'd be interested in hearing comparing traditional medicine. You said, and when you went to that conference, or maybe it's, over your years of study, that there's some kind of distinction in, is it regenerative medicine versus kind of traditional medicine, or what's that distinction? You kind of hinted to there being like a difference in maybe just overarching theory or understanding of how you treat or view the human body.
Yeah. I mean, I could probably go on for an entire podcast about like traditional medicine and a lot of things we just don't do well in traditional medicine. And that's how I'm trained. So I'm an MD, so I can still do traditional things and treatments and services if I want to. The issue is that with functional medicine, integrative, regenerative, you're really looking at the root cause of why somebody's feeling a certain way or having a certain disease process. And frequently what you'll find is that you can find answers and solutions in what the root cause is, and then you can actually work with the body within physiological parameters and how to improve cell health or optimize neurotransmitter levels or hormones or blood flow or things that optimize the cell to work better. So you're actually fixing the root cause. And so taking a long story short about maybe what traditional medicine doesn't do perfectly is we wait until we have a disease and then we treat. And then we're never taught to take patients off medicines. I mean, there's very few times except when you're using like a, as needed pain medicine, because you have a joint pain or swelling, that you're actually using something for a short period of time. Sure. Otherwise, we're taught to prescribe, but never take off. And so in tradition or in integrative functional medicine, we're actually working towards getting patients off medicines or avoiding medicines. And so that's because you're actually looking at why it's happening and preventing instead of just waiting for a disease to happen and then treating. So those are that's the big difference. And, I was in the ER, and what we were doing, we were treating disease specific or symptom specific complaints. So somebody comes in. I mean, there's very few times in the ER that people aren't, and even if they're not obviously looking for medicine, that there isn't some form of medicine involved. They're not sleeping well. There's a sleeping pill. They're anxious. There's a anxiety pill. They have an infection and it's thought to need an antibiotic. And really what we're trying to do is keep people from needing medicines to treat symptoms, and instead what's causing those symptoms, that we can change how the body is reacting. Sure. And then keep them from medicines. So for me, I was an anti-medicine person working in the ER, prescribing medicines for acute things. So it just didn't work well with my personality. Yeah. And so again, as you start to learn different things, you learn that it's not really even necessary. Most of the times you don't need medicines.
Even, mentioning your time in the ER, and imagine, it's an emergent situation, right? And so oftentimes I would imagine in that situation, you have to save somebody's life. You can't really get to the cause of like, why did somebody's life get into this situation in the first place? But, mentioning, getting to the root cause, like, that's a conversation I have often with clients too, is like, okay, if you have this knee pain, we could probably treat the knee, and get the knee stronger. But, if that's all we're looking at and, you're somebody who, plays tennis or like, how's the rest of your body moving? And if we don't, look at it from a whole perspective, then it's likely we're missing the boat of the outcomes that we could give you if we, take a step back and really look at the full movement pattern.
At how it all works together and how one joint might affect another, and, body inflammation and injury and how to get at improving. Yeah. What you're doing is, what we like to do too, is look at the whole picture and see how we can get them off of something. And I will say that your lead into that actually reminds me of almost the only time that I really want medicines is acutely when they need it, right? They come in and, they're ill or dying or, acute broken bones. Those are good times for it. But other than that, probably not too much. But
what you describe, I would hope that that's what most people want, right? To get to the root. I mean, it just really makes sense, right? Like if we can take the time to get to the roots cause of why this happened in the first place and address it on that level, like, so much of that, I see just, missing in, like you said, the traditional model, and it makes you wonder, like, looking at the health of, of Americans, of Tennesseans, especially just even in our area, like the number of prescription, I'm sure you're well aware of just the number of prescription medications that Tennesseans are on. I think it stacks up as one of the highest in the U.S., but because of this breakdown in the medical model, and likely not because of any fault of a physician, but just the system that the physician is.
It really is the system, both for patients and physicians. We can only really do what we're taught. And they say about 50% of what we learn in med school is actually going to be wrong. And I would say maybe sometimes it's a little bit more than that. But I think that that's exactly the point, is that there's a lot of medicines prescribed, and traditional medicine. And I don't want to say, what I would like to see is physicians that maybe don't feel like they have yet, branched into, because it's really hard to break the traditional medicine mold and to get out of a practice that you have and you're used to treating. I want to partner with those physicians that might want alternative options but aren't comfortable with them, or hormonal optimization but aren't comfortable with it, so that we can work with them, and educate them when they don't know it. I would rather them send it to me or call me, so we can discuss, because I would be more than willing to help them, help patients. And likewise, I think this is one area of medicine where patients come in more proactive than sometimes physicians, because they're looking for alternative things. So there's a lot of our patients that come in looking for alternative ways of doing it. They've to the physician, they've been told everything looks good, but they read and they know that there's some other things out there that they can look at. And so I find our patients aren't on a lot of medicines or don't want to be on medicines, and that's why they're in front of us. So that's very exciting for us.
You're in the field of regenerative health, was, just interested even in that term, like regenerative health. Like, how would you define that, like, to the public? What does regenerative health actually mean? So
I think that there's a few different terms. Like functional integrative medicine, you're really kind of looking at the root cause and kind of getting at how to prevent a disease and optimize the body. And regenerative medicine is kind of taking it a step further, where you're stimulating the body to repair itself in some way. There's so many modalities that we use to do that. Hormone optimization, cellular health, making that cell healthy. And that can be a multitude of things: nutrition, blood flow, exercise, stress, again, what we're mentally communicating to our cells matter. There's hormone optimization, there's toxicity. I mean, we live in a very toxic world. Mm-hmm. So optimizing that is key. But then we go to regenerative, where we're actually doing things to the body to tell it it's injured, and to repair. Because a lot of times the body will repair itself if we give it the tools to repair itself. Sure. So if you make the cell healthy and then you give the body some tools that it needs or signals it needs, it can actually regenerate itself. And And I really strongly believe that if we believe that, then we have the best outcomes, right? Because again, what we're communicating to our bodies matters. And so it's not just anything that we do, but it's a patient partnership. So they have to do their part too. There has to be some nutrition and some fitness and, and activity. And then again, stress control and, just thinking the right way.
I'm just aware of even just regenerative medicine. It seems like recently there's really been an explosion of just that field. And I'm sure you're better to speak to why that is. If it's just the age of kind of some of the aging population, or if it's like advancements in our understanding of whether it be stem cell or, these other things that are coming around more. But, it's a term, I don't know, 5 years ago, like, I don't know if I really saw a regenerative, a clinic that, really was practicing regenerative medicine.
Yeah. Well, I don't think it was really heard of, 5 years ago. And because even when I started this journey about 10 years ago, I didn't hear that term as much. I think I started learning more about hormone replacement, and then naturally one thing grows upon another. And so, you learn, and even as the hormone optimization, then you would learn about how GI health is affected. And a lot of diseases start with inflammation in the gut. And so you have leaky gut, and then you have neurological and cardiovascular ways to help. But regeneration is, I think, an evolution in all of that anti-aging, because now we know, and PRP was probably one of the starting points of that, and that's been around for years and started
PRP is
platelet-rich plasma. And so what we do with that is you draw blood and you spin it down, and you're really getting the platelet concentrated plasma. So platelets have growth factors in them. And so we're using your own blood to repair tissue, and we inject it in multiple different places, but it's been around orthopedically for years.
Sure.
That's where it started. Tons of great studies, and the benefit of PRP is phenomenal. And I think that started that move towards regenerative medicine.
Sure.
And so basically you take the platelets, it's a concentrated form, and you're re-injecting, and you're telling the body it's injured. So it's like having a cut on your arm, right? You have the cut, and the platelets go, they stop it from bleeding. And then they're there stimulating stem cells in the area of the arm to repair arm tissue. So when your cut heals, it's arm tissue and not hair, or scalp, because there's stem cells intrinsic to an area. And so when we inject PRP, it's injecting platelets to stimulate the stem cells to regrow. So that was the starting point. So then it goes to stem cells. So are we going to stimulate our own stem cells to repair, or should we inject new healthy stem cells? Or are we going to harvest it from an area of the body? And people have different beliefs and all those different sources of stem cell. And then it goes further to some of the stuff we do with sexual medicine that include other devices to stimulate injury.
That's what we want to really get into with the episode today. So, understanding that's a particular interest, and it sounds like a large portion of your clients at Revitalize, you're meeting the needs of their sexual wellness and through sexual medicine. Is that correct?
Yes, yeah, okay. Absolutely. It's a passion of mine.
Awesome.
And I think that's one area of medicine you haven't heard as much about. So, 10 years ago, we knew what Botox was, right? 5 years ago, we didn't know what regenerative medicine, and sexual medicine is still really new. And so again, as I'm aging and going through, just general changes as we age, aging is inevitable and we can't prevent it, but we can control how we age. And so that's what we started doing with hormone optimization. So what would happen is patients would come with those general complaints. I'm tired, I have brain fog, I'm gaining weight, my libido's down, they're not sleeping well. They're not handling anxiety as well. And for men, when testosterone declines, it's significant. That's, the life force of a man. And so that changes. And so say they came to me for hormones. Well, I started recognizing that there's a lot of functional changes sexually that they're also having. And so it just kind of naturally evolved to figure out how I could help with those as well. And so early on, I started to institute what's called a P shot and a no shot. And again, we have multiple modalities to help with sexual wellness, but this bridges in between both men and women, but they're just termed different things. But we're using PRP with those to inject it locally into an area to improve blood flow, nerve sensitivity, and repair in that area. So that's one of the areas of sexual medicine. But now people are coming because now we do a lot of sexual medicine. So those modalities we have, they either come to me complaining or noticing some functional changes sexually, and then we're talking to them about hormones because they go hand in hand, or they come to me or us with hormonal changes, and then we're talking to them about some things we can help them with sexually because they're noticing both. And what's interesting is people will talk about, being tired or low libido, and maybe not even low libido always.
Sure.
Weight gain seems to be a big one, fatigue and brain fog. But not always do they want to talk about those changes. And so it's like nobody wants to talk about it. And so they come in and they have it. They had no options, nowhere to go, nobody with answers or solutions, and nobody really comfortable having the conversation. So we are very comfortable having that conversation. We have lots of different ways to help. And so seeing the benefit and seeing how life-changing it is for patients just has naturally, again, changed, my direction in what we're doing. And it hasn't changed it, but it has definitely became a focus and passion of mine, is to help, because there's not a lot of options out there. Actually, recently we were at a conference and it was in Vegas, and there's a lot of California-based med spas there, and not anyone that's doing sexual medicine at all. So we're really, pushing, those boundaries in Knoxville, Tennessee.
Sure.
So
I'm sure that takes a little bit of boldness on your part.
Yeah.
Just considering, the cultural area that we're in, being here in the Bible Belts and more conservative, like if that's, I don't know how you've managed to kind of overcome that obstacle of kind of that taboo of discussing any type of, sexual decline or need or health.
And it really hasn't been difficult at all.
Okay.
I think that maybe 10 years ago in Knoxville, it might have been a little more difficult, and maybe it's just where we are now, but we just don't see it. And maybe it's because, again, to me, it's a very vulnerable area. So we take it very seriously, and, it's highly professional and a private thing. But I also want people to know they're not the only ones having those issues, and that, in fact, it's inevitable that all men and women will have those issues over time. That's the only guarantee, is that we're going to notice some functional changes. I mean, obviously, if we look as we age, we get skin, hair, nails. We start to get that middle that's a little bit bigger than it used to be, right? Our muscles aren't as strong. We're tired. We're not thinking as well. We don't want to work out anymore. Now a 12-hour day or a 10-hour day doesn't land you in the gym, right? You're too tired. And so in addition to that, we're all going to notice those changes that aren't so obvious. And those are those functional changes men and women both go through, and it's inevitable. But so for me, I think it just was natural. And again, we're very... the office isn't set up to just promote that. We do aesthetics, we do wellness, we do IV therapy. We're about cellular health and regeneration on a cellular level. And so I think people are very comfortable coming to the office, and that's what makes RevitalyzeMD special, is that everybody in the office is comfortable. We also know it's very vulnerable, but I want people to know that they're not the only ones, and that everybody is, and really actually preventing those changes is the key. So the earlier we can have those conversations, the better.
Well, we're going to take a quick break, hear a word from our sponsor, and then the second half really dive deeper into how Dr. Durst with Revitalize helps people in the area of sexual medicine.
Stay Healthy Knoxville is sponsored by Simply Physio. a physio clinic that equips and empowers you to live your life to the fullest so that you can enjoy the things you love to do and be the person you are made to be. Simply Physio specializes in helping people get back to a healthy and active lifestyle, living free from pain and medication and avoiding unnecessary surgery. Stay tuned until the end of the episode to receive a special gift from Simply Physio and enjoy listening to the rest of the episode.
Well, thank you guys for coming back. We're diving right in. Dr. Durst, be interested if you were to start us off with maybe a story of a client or a typical client when they're coming to see you. Like, what are their main concerns? Like, why are they coming to see you? And take us maybe on that process, that patient experience of how you get somebody started and kind of that journey from there.
So I do, want to first clarify that we do like a very comprehensive array of services. So we do a lot of aesthetics too. So some people will come to us because they have something, that's bothering them about, skin or hair. And then some people will come because of those symptoms we've talked about. Their brain fog, they're tired, they have some weight gain, or they come because they're noticing some functional changes sexually. And so it could be a multitude of things. I think no matter what they're coming for, we're going to listen to their concerns and kind of gear our evaluation that way. So if somebody comes with those general symptoms of weight gain, brain fog, energy decline, libido decline, not to say those things over and over again, but it's an everyday conversation that we have. And again, it's an everyday conversation that they've been other places and they come because they seek it out. And so it's really easy to do a consultation, call the office and get in to see one of us for a consultation, whether it's aesthetic or wellness. And we sit down and we go over everything. It's a comprehensive discussion and meeting. And then we will end up proceeding after we thoroughly evaluate medical history and what they're, really concerned about, then we can gear our workup. And a lot of times that includes blood work. And so what happens after that is really where the magic happens, because we sit down and now we have numbers. So we can tie their symptoms to some things we're seeing. And again, we have hormone panels, but we do more than just hormones. We're looking at diabetic markers, insulin resistance. We do advanced lipid profile testing, and more than you do a lot of times in traditional medicine as well. And then we have ultra health panels where you can do micronutrient testing, get amino acids, antioxidants, vitamins, minerals, and levels back. And so we do a lot of IV therapy as well. And so again, when we sit down and we look at all those numbers, whether it's a person with a more isolated but still comprehensive panel, or the ultra health panel, which is what I call it when we go into that micronutrient testing, we sit down and then we can have a talk about what their body might be deficient in and how we can help. And then that meeting and an appointment is a lot longer.
Sure.
And then we can start to discuss different options. And again, they're coming to us, sometimes for general symptoms. Sometimes those are hormone related. And then sometimes it's a sexual, kind of difference that they're noticing. And so no matter what, they tie together because we're looking at how to make that cell function optimally again. Help them with their symptoms.
Sure. And so you have a client coming in, go through, the full medical workup. It sounds like a lot of, you get a lot of information just about how their body's functioning through this lab work. I would be interested in if, so you get this information back, and if there's certain trends or a common pattern that you see in the numbers. And I know it's not the same for everybody, but that would kind of take you into a certain direction of treatment. Mm-hmm. Because you have a lot of different options of treatment, right? So what are maybe the most common ones that you find that people need, or a common starting treatments?
Yeah. So again, there are very common patterns here, that we see over and over again. And so I've already mentioned a lot of the common symptoms. But, depending on the age, There's, a perimenopausal, a menopausal, so as we age, our hormones are declining. In men, they do that too, but it's one hormone. So it's a little less complicated than women. It's an interplay of different hormones for women. And then also what declines with age is growth hormone. And so growth hormone, again, you start to notice skin, hair, nail changes. And so a lot of times, some of those skin concerns we're talking about could be hormonal and growth hormone decline as well. And so for us, as patients start to feel better based on some comprehensive treatment plans. And again, it's based on what we're seeing with both numbers and symptoms. They start to feel better. They want to look better, or they come in and they want something done, but they're of an age where really, we can do all these treatments and we can inject and we can do aesthetic services, but you're not going to get sustained results if your hormones aren't optimized or if your cell health isn't good. And so a lot of times we see patients younger and younger now. And so we'll see people in the 30s with low hormones. And why is that? It's probably because we live in such a toxic world that, our cells aren't functioning the way they should. And so we get a lot of young patients just with IV therapy alone, that come in complaining of fatigue, those same things, weight gain.
So the IV therapy, that's the your recommendation or what you find for hormone replacement?
Sometimes it's part of it. So again, it's kind of a comprehensive plan. So if they come in and we think there's a nutritional component, then we're going to start talking to them because again, supplying the cell with vitamins and minerals and nutrients through an IV is sometimes very beneficial and boosting them back up. And it helps also prevent, illness acutely if we have patients that are patients of ours for other things. But again, for me, with the wellness, it's a hormone kind of general complaint and decline. And then as you start to open up that conversation, get the blood work back, then we can also talk about the other changes. Because when men and women start to age, they'll notice things. So women, again, they'll start to notice hot flashes, night sweats, and maybe vaginal dryness, maybe pain with sex. And those are a lot of things that part of it's hormones, part of it's blood flow, part of it's having children, and some changes that you go through. But there's a lot of things we can do to help that. And likewise, men will notice changes, and hormones and blood flow can be it. And there's lots of different modalities to help them too.
So it sounds like, the hormones, really checking the hormones is oftentimes like the first line of defense, if you will.
Yeah. So I guess a long answer to your question is, so, the initial starting is like, if they call for a consultation, if they're feeling anything and they want like an opinion, like if we get blood work, then we can look more comprehensively. So now we're sitting down with numbers and talking to them about symptoms, and then we formulate a plan. And so if it's hormone replacement that we need, then we can do all of that from the office.
Sure.
After that first initial, but then that full comprehensive appointment where we go over the blood work too.
And, mixing that with, the integrative functional medicine, like the hormone replacement, is that something that people typically need to have some long-lasting kind of treatment plan, or is it something that gets restabilized and they can kind of get back to a state of health where they don't need some sort of replacement treatment?
Well, if you look at hormone decline, what happens is we start to age and we get a decrease in our hormones. It's just going to happen. And that, again, is inevitable. And it never is going to go back up. It's going to be a constant decline. There's an occasional exception to that rule that's way beyond, this podcast. But for the most part, men are going to have a decline in testosterone and women are going to have a decline first in progesterone and testosterone. And that can happen in the 30s. And then in that could happen in the 30s, but in between 45 and 55 for women, that's really happening, and they're becoming more estrogen dominant, and they're noticing a lot of changes related to that. And then finally, estrogen declines when they're menopausal. But in both sexes, growth hormone decline, it peaks at 20 and it's going down after that. So there's ways, and I'm not advocating growth hormone replacement, but there's ways that we can stimulate your body to increase growth hormone. But it's never, none of those are going to go back up, except for those exceptional cases, because it's part of aging, and all of our diseases start as we age and our hormones decline.
And I know you have multiple other, services to help people with different areas of sexual health. Can you take us into some of the other services that you provide that you find is very valuable and oftentimes needed for people?
So I'll use you as a potential example,
okay,
right? Just to put you on the spot, because you're way too young for this, so we can do that safely. But if you come down in complaining, say you came in because you're noticing some functional changes sexually, for instance, it could be, erectile changes is a very common complaint if we're talking about sexual complaints. And this is very it's all over. You can Google it everywhere.
Sure.
The information is out there.
Yeah, people know
you have
erectile dysfunction.
Yeah,
right?
How do you help erectile dysfunction? And so you go to Google, right? Google always has the answer, but there are multiple different ways we can help. So some of the things that men will notice is loss of morning erections or loss of nocturnal erections. And again, if we're not getting blood flow in there, it's like a use it or lose it kind of situation. And so the time to improve that is early on. And so some of the things we do, we'll evaluate where they are with that. And we have a scoring system. But basically what we want to know is how they're feeling, how we can help them. And a lot of times it's loss of confidence, just even if it's happened a couple times. And so those are that's when to intervene with Gainswave is one of the options we do for men. And that is an acoustic shockwave therapy that basically is telling the body it's injured. And so we're doing that in the penis and around the penis scrotum, because you want to increase blood flow in. And Gainswave is phenomenal at increasing blood flow. And it's great actually for peronees too, which is a curvature in the penis. And so a lot of men will come complaining of that. And then likewise, we use the P-shot. So the P-shot is PRP. And so basically we're using that platelet-rich plasma. And so we're drawing blood, spinning it down, getting the platelets, re-injecting them to stimulate your own body to increase blood flow and nerves and nerve sensitivity. And so it increases erectile strength and function. And so it's getting you those erections back that you were noticing changes in. And so it's increasing sensitivity, orgasmic strength, all of those things. And so phenomenal in combination between Gainswave and P-shots.
So is that something that someone will then need to have kind of go through a program of a frequency of treatment and get to the point where they have ongoing or graduate from that type of treatment?
I like to almost compare it to, at least people can relate to what they do on a daily basis, right? So, or on a yearly basis. Maintenance of a car, for instance. We never completely are done maintaining our car, right? Mm-hmm. We always have to maintain it. And likewise, sometimes if we haven't maintained our car in 20 years, but we've had some oil leakage, or hypertension, or high blood pressure, high cholesterol, those things in the human body, then we definitely have to maintain and do some things. And so it's never going to be one and done, but it is individualized. And so the earlier we can have those conversations, the quicker the improvement or the function improves. And then we can get them on a maintenance program as soon as possible. And so, but it's just like anything else, the house, the car, we spend a lot of money on our lawn, our car, and our house, but not as much on our body. Mm-hmm. And this is how we enjoy the lawn, the car, and the house. So
you can't just replace your body.
You can't replace the body.
Go out and buy a new one.
But it really is a change in perception or change in how people think about it, because they understand they have to maintain everything else, but they don't always understand they have to maintain, their physical body as much. And so that's also how we prevent those diseases from happening.
So is there, comparable, if you will, treatment than for women. We've been talking about men here recently. And we talked about
you went off the hot seat, don't you?
That's right. That's right. Unless we're not finished there, but I'm happy to go to the women now.
More than happy to go to the women.
Right.
But, well, likewise, there's definitely this similar treatments. They're a little bit different. Obviously we have more hormones that we're kind of balancing as they decline. But likewise, and I'll kind of go into after how I think also couples kind of grow apart and change as they age. But for women, we're doing the same thing. We're doing an O shot. So the O shot is PRP. Again, using your own blood to repair. We're re-injecting it. And I do want to clarify, because you haven't asked, none of these are painful. And I promise you that's the case. I would never lie. People wouldn't come back to me, right? And so they sound painful, but we've been doing them for years. And so we have techniques in making them completely comfortable. And likewise, we use the best kits, we use the best techniques, and we know how to make it so that you almost don't feel anything. And most people don't. But for women, it's called an O shot. And it's PRP that's increasing blood flow and nerves to support. Basically, a lot of women are coming with stress urinary incontinence or urinary incontinence. So as we have children, we have the weight of the uterus that goes, and it really is obliterating our supportive tissue outside of the vaginal canal. So women, again, frequently complain of, I'm jumping on the trampoline with my child. I go to, exercise at the gym or run. And this is something men don't complain of. And they have urinary incontinence at a very young age often. And so we inject this in an area that helps support the urethra again and improve their urinary incontinence. And a lot of women will have that improvement after one O shot and sometimes immediately. I don't like to set that expectation, but a lot of times it's really remarkable how quickly they improve. And then we also do vaginal rejuvenation, or I should just say regeneration, is a better way to term that, where we don't use acoustic shockwave and Gainswave like we do with men, although we can. There's a female version of it called FemiWave. But what we do is we do laser treatments, and there's different laser treatments you can use. I don't believe in ablative laser treatments for regeneration. I want to use non-ablative. So when we have
ablative,
two devices, ablative kind of just means you're taking off the superficial layer of whatever you're treating. So if you have an ablative laser treatment of the face, you're taking off some level of tissue on the face to resurface. So the same thing would happen in the vaginal canal. So is it safe? It probably is, but I don't believe that that's what we should be doing vaginally. I feel like, and so we have two devices that we use, but both of them use heat to stimulate injury and to basically tell the tissue it's injured so that it repairs itself. So women over time, lose their hormones. They start to get pain with sex. They start to get vaginal dryness. And even if they have breast cancer history, a lot of times we can do some of these as a local treatment to improve their symptoms, and they don't need hormones. And so we're using that laser device then to further stimulate and help the PRP that we're injecting. And so again, that in combination is really phenomenal at getting results from women and improvement of their symptoms. So they can now jump on the trampoline with their son, go for a run without, worrying about leaking when they're doing so.
Are there any other questions like, does it hurt? Maybe things that would be helpful just to mention here to the audience if somebody was interested, but maybe common objections or things that kind of scare people or hold people back that people just have questions about before they're ready to get started? Or are there any other certain questions like that?
No, I think pain is a huge
common
question.
one, yeah.
That's a huge, and it isn't painful. I think that a lot of people want to know more information. We have a lot of information on the website, but really, it's such an individualized treatment plan that coming into the office, sitting down, talking about the symptoms is probably the best way to get
just like the next step.
And then then what I would like to say that I think is in this February month, which is Valentine's Day and, a month for, for lovers and couples, is that we do a lot of couples treatments where men and women come in together. And so what I find with age is that men tend to get less firm erections. And so they're losing erectile strength and intensity. And then they're lacking the confidence. And so they want to hurry through it, right? Because they don't know how long it might last. Where women, as we age and our hormones decline, we need a little more time. And likewise, we're a little more laxed because of childbirth or just hormonal decline. And so we need a little more time. We are laxed or a little more space, and they have their erections are not as firm. And so we're not fitting as well, right?
Sure.
And so we like to bring couples back together, and having that conversation at the same time is not an uncommon happening in our office. And so I think that this month is a perfect time for that. We always run specials in February to bring couples in together. And again, sometimes there's things that we can add there's so many different modalities to it. We're not talking about just hormonal optimization or PRP or Gainswave or laser, but there's peptides we can do that increases libido in a different way or arousal in a different way. And then there's other medicines that can increase blood flow. And so there's so many different things you can do. And so having those conversations together, and likewise, there's things that men can do to help women, because again, a lot of that arousal is a blood flow. And so spending a little time initially can really result in better, relationship moments together. So we like to open up all those conversations when they're in.
You mentioned having some specials, and understand that for the Stay Healthy Knoxville community that you wanted to have a special or offer for any listener here. Tell us a little bit about that, Dr. Durst.
So we do have a special offering for listeners specifically. So if you call in, and a lot of our combination treatments, when we're talking about the different ways we pair it together, we call them treatments specifically. So if you call in and you say Rev It Up, which people should be able to remember based on a lot of the stuff we just talked about, if they say Rev It Up, that's a code you can use when you call to the office. And then we actually have a libido stimulator supplement for both men and women that they'll get as part of their package if they come in. Okay. And then also in February, again, we offer a couples. So if they come in, we have single specials if you're coming in and it's just, a woman or a man, but also you have even a different offering for couples that come in together this month.
Want to transition to the tail end of our episode here and find out a little bit more about some recommendations that you have for people to explore the area. The first one would be wondering, Dr. Durst, if there's something on your bucket list here around Knoxville. I always like to encourage people to get out there and explore.
One of them is not Knoxville specific, but ballroom dancing. I've always wanted to do ballroom dancing, but I have not done it. And so recently we actually ran into somebody at the Women's Health Expo who brought it up. So just brought it to the forefront again. So I'd love to do that. That's not an outdoor or Knoxville specific.
Doesn't have to be outdoor. That's a good one though.
Yeah, no. And then not Club LeConte, but Mount LeConte would love to do. I've done like 3/4 of it and not stayed, and we came back down and
staying in the,
I would love to stay. Yeah, I haven't done that
lodge
yet.
Yeah.
I'm almost embarrassed to say I've been here for almost 17 years and haven't done that.
My understanding is, I think you got to call well in advance. It's, the popular spot to get up there.
So if you have any connections for me, because I'm not a big planner, I'll just say.
If you're getting out, want to go out to eat, what's one of your favorite restaurants here around Knoxville?
I love Chivo's downtown. Love Chivo's. One of my favorite places.
What kind of, I don't know much about Chivo's. What kind of restaurant is it?
A Mexican restaurant downtown. Okay. Yeah, it's awesome. Great ambiance. Like the restaurant's awesome. The menu's great. Like their rye Felicia. But yeah, no, I really love that restaurant.
And then leaving with our audience, what would you leave as far as your best or top recommendation for staying healthy?
I honestly, and I can't say that I do a great job of one of them, but balance is huge, so if you could make sure that you balance life, and that means work with family, but taking time for yourself as well. So it brings me to the second one, which is really stress reduction.
Mm-hmm.
The best thing we can do is stress reduction. And what I find helps me the most is, number one, a workout, but really the sauna after, and meditating in the sauna. And I'm not like a big meditator. I don't know how official my meditation really is, but it's very stress relieving for me.
Great. Well, thanks for sharing. And if somebody wants to find out more about you, about RevitalizeMD, get in contact, tell us what's the best way to do that.
So RevitalizeMD.com is our website. But if you call the office, 865-293-5828, that is the best way to get in touch with us. And if they call, the office is phenomenal. The staff's great. So welcoming. You'll get all the information you want on the phone to get you in for an appointment. And then you'll love the office and the staff when you come in.
Definitely, I can vouch for that. I went over there, I guess, a week or two ago, and it's you guys have done a great job of just creating that ambiance that's welcoming, and especially I'm sure dealing with the topic with a lot of people, a sensitive topic, that I can tell you guys really thought through all that there.
Yeah, no, and it couldn't be done without the staff there welcoming everyone. So. But thank you so much for having me.
Yeah, well, thank you for sharing on this topic that I'm sure it's needed to get out there. So I'm very thankful to have you here on the show, Dr. Durst.
All right. Well, thank you so much.
All right. Stay healthy, Knoxville.
Stay healthy.
Thank you for tuning in to the Stay Healthy Knoxville podcast, brought to you by Simply Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, pain medicine, or just want to get back to doing the things you love in and around Knoxville, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at simplypt.com/health-tips. There you will find ebooks for topics such as neck and shoulder pain, lower back and hip pain, knee pain, and TMJ. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit simplypt.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation phone consultations with a doctor of physical therapy to Knoxville area residents. Just call us at 865-351-0615 or visit us at simplypt.com and click the Talk to a PT button on the home page to schedule a call with us. Thanks again for joining us, and we will see you next time on the Stay Healthy Knoxville podcast.